and go successfully pass the 18 months audits. So that's where you're going to send your guides. If you want to do it on your own, you can do it. But then you have to be very careful about the quality processes. This is just an example of the cleaning procedure. Use fresh isopropanol, soak parts 20 minutes in that, dry clean that, etc., etc. All the processes are agreed in these agreed production centers. The production centers need to refer to you the guide in less than 3 days also. You are not going to wait 15 days for that. Only 3 days. The guide flavors, you have guides which are called one-shot or spoon guides. Let me show you. A one-shot, you use one cylinder, which is 2 millimeter cylinder, and this is the guide tray. Very simple. Don't tell me we cannot afford computer-guided implantology. You can start with this. Very simple. And this is the first step into guided implantology. You drill in one shot. Then you remove the drill and you have the entry point, and you can use your own implant system, own drill system, and you can finish like that. This gives you 3 information: the impact on the bone, the length of the osteotomy, and the angulation of the ostomy. This is far enough what we need when we need to start placing implants. We can use that also. This is a case which we did in Dubai, an orthodontic case, and I planned implant to impact the back teeth, so I've been planning implants. You see how close we are to the roots. This is very difficult to plan implants like this and to place them without touching the roots. So this is the guide, this is the plan, and this is the way we do. We use the surgical guide with one drill, and this is the end of the surgery. No bleeding, no flap, the security to place the orthodontic implants in the exact right position, and then the orthodontist is going to be able to put the elastics and pull up the teeth. This is after extraction of the premolars. The spoon guide will refer to you as a series of steps to dry and to clean and to place the drills and to place the implant in the exact right position. So this is what we call the spoon guides, because we're going to use the spoons into cylinders. This is the surgical tray. So we start with trephines to remove the soft tissue in case we want to work through the gums. And then we go to the 17 millimeter drill, which is indicated in this case, and we are going to go step by step. 2 millimeters, 2.85, 3.25, 3.70, 4.25, and then we are going to guide the implant, and we use the guide which is the implant driver wide short up to 6, and this is done. I show you this case. It's not my case, it's the case of Dr. Jocelyne Charest. This is her first case. It's not really a first case. She's been planning one implant before that in her life, and it's the second case, but it's first guided case. So look at this. She's been planning the case on AccuGuide. She's been making the guide like I showed to you how to do. She's been planning 6 implants. These are the implant plan on the software. The case has been fabricated in France on an Objet 3D printer. You see here how the guide is. It's a mix of acrylic, which is strong, and a support, which is wax, because you cannot just put acrylic in the space like this. You need to get a support. So the support is wax, and then there is the acrylic. And it looks like this. It looks like this in the machine. Then we clean the wax, and we get the guide. This is the guide, okay? So she's been using, this is Jocelyne Charest. She's been using the guide over the bone, and this is the guiding sheet where she knows how to use the drill length and the implant drivers. So she's been elevating a flap. She placed a retention screw here to stabilize the guide, which is very stable, and we obviously find the good position. So she's been drilling the 2 mm spoon, drilling down to the bottom, placing the implant down to the bottom, and these are the stitches, and this is the OPG at the end of the surgery. Her first case, okay? So she was not scared, and she's been doing this case from A to Z in 1 hour and 45 minutes, okay? So I am not talking about things that are difficult. This is difficult when you do it on your own and you don't know where to place the implants, you don't know where is the nerve. But when you use this technology, you go to a more secure, a faster, and a more secure way to show to your patients that you are using the right tools. So this is another case that I did. I wanted to show you how we've been able to import the ESTL image token on a TRIOS camera. So this is the case, a simple case. We don't need to do complicated cases. We need to do simple cases with guided implantology because the price have been dropping down so much that now we don't need to reserve that to big cases. So this is a missing premolar. This case is difficult because we have a very short space in between the implants, the roots, and we don't want to touch the adjacent roots. So I am making a virtual wax-up first. So I make a wax-up to replace the missing tooth. We have two ways to make a wax-up. We can use a library of implants, of tooth, like on the left side, or we can use a symmetry. So I have been taking the tooth, which is in yellow, I select the symmetrical tooth, and I put the symmetrical tooth on the right side. I make a wax-up, like at the dental lab. On the lower, I am going to slightly move this tooth, put it in the empty space, and this tooth is going to get the exact right position where I want to place it in. I am making a wax-up, but instead of taking impression and sending that to the dental lab, I make the wax-up on my computer, okay? And there are two ways to make wax-up. Use a library of implants or use the opposite tooth that I place here, and you see again how easy it is to make a wax-up. We can also include the occlusion if we need, using the digital image with the occlusion. I am not going to show that to you now. So this is a digital image. It is not a plaster cast. It has been taken using the capture of the TRIOS machine, and this is the image I got with that. It took me about 1.5 minutes to take this image. And then this image was exported into a STL file, and then this STL file, I'm going to show you how I'm going to implement that into the software. I can overlay DICOM or an STL file. I choose STL file. I am going now to go and select my plaster cast image. Okay, it is stored in my digital images, DICOM and plaster cast. I select the plaster cast, and I am going to show you how to do that. This is done manually. On one side, I have the image of the jaw coming from the TRIOS image. On the other side,